now it's already there on the screen also. It is about feeling disconnected or isolated. Despite, so loneliness is being alone is you really don't have anyone. There's no relative or anyone in the house. Loneliness is sometimes you are having people around you also, but you start feeling lonely. You feel disconnected. You feel are you able to hear me?
Yeah, now it is better, ma'am. I think there is some internet issue there.
Yeah, there's some internet issue, I think so.
Yeah, now it is better, ma'am.
It's raining heavily in Goa. The screen is visible?
Yeah, screen is visible, ma'am. Yeah.
Yeah, right? Okay. So what happens is being alone is something and loneliness is something. So being alone mostly is when you don't have anyone to be with. Loneliness can be a result of being alone, like not having anyone. So loneliness sometimes can happen when you're in between people also. And this loneliness is increasing a lot. Okay, because it's seen that out of three, at least one elderly person feels that he or she is lonely. Could be various reasons for that matter. Could be retirement, a lot of, I'll come to the reasons later, but the number is increasing. It is 1 out of 3 people are feeling that they are lonely in this world, and mostly it is affecting the elderly. This topic is very, very crucial as it is affecting
Probably Dr. Akshada. Dr. Akshada. Dr. Akshada.
Can you hear me?
Yeah, now only we are hearing. I think there is some issue with your internet. Can you just think of changing to some other network or something like that?
I'll just try that one minute.
Please,
just hold on.
Please. One more problem is just raining heavily in Bangalore. That is also affecting internet. Yeah.
Are you able to see me now?
Yeah.
Is it clear?
Yeah, clear, very clear, ma'am.
Okay, great. Just a moment.
You have to share your screen.
Yes. Here. Now it's okay?
Fine, ma'am. Fine.
Okay, great. I hope it doesn't get, I've changed the listing. Okay, so it is becoming a very crucial topic, as I said, loneliness, because it is affecting the mental health also and the physical health also. Okay, and this is leading to a lot of premature deaths. People who could live probably because of medical advancements and a lot of new advancements are coming in. The elderly are able to live up to 90, 95 years also now. But because of loneliness and depression, now the age is going on reducing. So now let's see what are the causes of the loneliness in elderly. So loneliness can be caused due to many reasons. Okay, I have listed 3 different factors. One is physical factors. First one, physical factors meaning after a certain age, there are issues with your movement, that is mobility issues, back aches, the feet are paining sometimes, neck is paining, head is aching. So a lot of physical symptoms can lead to an elderly feeling very irritated, frustrated, and not feeling like going and meeting people outside. This can limit an elderly person's ability to engage socially. They will not feel like engaging socially. Conditions like hearing loss or vision impairment also contribute to the same. Like the person is not able to see properly or hear properly, he or she will not feel like going and meeting people in like meeting in groups, because they feel okay, fine, if I don't hear properly or see properly, I might be made fun of in the group, or I will not fit in the group well. So they restrict themselves from going to the group meetings. Social factors like impact of losing a spouse or some close friends, like losing your spouse is the biggest event of anyone's life. Okay, that can put a person low on mood at any age, that is not only elderly but even at a young age, or elderly all the more because that's the only companion you're having at that age. Losing that companion makes it very difficult to like think of survival. Sometimes losing some close friends, you're going in a group, you're meeting a group of friends, but suddenly one or two friends of that group are no more. That also puts you under that loneliness feeling. Children moving away, so after a certain age, like I have noticed, that is 60 and 65, when around the retirement time, many of the time it happens that you are retiring also, at the same time your children are also moving out for their studies or they're getting married. So that is another reason where around 60-65 someone can start feeling loneliness, or they can start feeling depression kind of a feeling. Mostly happens in both the genders, males and females. It is also known as empty nest syndrome, because the nest which was full with the birds, the kids and everyone, has suddenly become empty when the children have left for their work, right? So there is a social factor, and the psychological factor would be experiencing anxiety that leads to anxiety depression. So these are the causes of loneliness in the elderly, which can keep like a person detached from the society, or not feel like getting mixed with the. You might
Again, there is an issue.
because you're not went out and meet people, right? That can be happening. Other than this,
Again, there is an internet issue, ma. Again, internet issue is there. Doctor, I mean, again, internet issue is there.
even now,
And now it's better.
wait a minute, I'll just keep my phone this way then.
Now it's
It's
better.
raining heavily here in Goa, now, so internet has been very unstable past few days.
Even in Mumbai, it is, I mean, even at Goa, it is so. Look at Bangalore also, it is, I mean, somewhat.
Yeah, it's very heavily raining. So, okay, so what we have seen is loneliness, and also things like depression, anxiety, if happens in elderly, it puts them to a direct risk of dementia or decline in the memory also. So that is also one thing for which we should, if you start feeling lonely, if you start feeling depressed, or you feel anxious at a certain age when you're old, it's important to go for professional help. Physical health effect, what can happen is, because of feeling lonely, because of feeling depressed or anxious, yes, this can lead to heart diseases. Okay, so heart, high blood and sugar disease. Hello.
Yeah, again, yeah, now better.
So
I have a suggestion. I have a suggestion. You can switch off your video. Maybe it will help. That may help.
My video, okay, I'll do that then. I think we always, you all are having issues, right?
No, in fact, see, I can do one thing. I can switch off the videos of all the people. That's not an issue.
I think switch off the video and we'll see if that is going to help. We'll do that.
Okay.
Yes. You also can switch off if you want to. Any questions, then we can maybe question answer. We can come back.
Correct. Doctor, you can switch up to mobile data and try. In case if Wi-Fi, if it is not working, you can.
No, I tried both now, sir. Both. First was Wi-Fi, that was not working, so I have now put on my mobile data. Because the rain, this problem we are facing in Goa.
Carry on with
We'll see
audio
how far
only
we can
without any video. Yeah.
Okay, yeah, we'll see. Yeah. So, how to identify the signs of loneliness is that what I see in my case, like one of my patients had come recently, the children brought him to me saying that Papa used to love going for parties, he used to love going for events, and now suddenly for last 2 or 3 months, he doesn't want to go for parties. He starts giving reasons as to it's okay, my friends are not coming, or someone might be there whom I might not like talking to. I don't want to go for this. So the children found it a little odd. First they thought maybe it's the old age, so he did not wanted to go out. But then slowly it started deteriorating so much so that he started sitting mostly in the room itself. He didn't even want to come out and talk to children. So that was something which was troubling them a lot. So they had brought him to me, and after talking to the patient gave history of loss of his one of his very close friends who was a part of the group. And since the loss of the friend, this patient had started feeling very, very low on mood because he was the only friend whom the patient would share everything. He would tell about his day-to-day activities, what would like if the children were not listening to him or going against him, he would share with that friend. Okay, his wife also said that he was very close to that friend of his. So that had led to a lot of loneliness in him. Though he had a wife at home, he had children at home, he would talk to them also, but that group thing was really that friend was really like it was he was missing that friend a lot. So what behavioral signs are noticed in patients who have got this is they have withdrawn behavior from the society. They don't feel like talking to anyone in the society. Okay, sorry. They suddenly start neglecting their personal hygiene, changes in sleep habits, lack of interest, frustrated, they'll shout a lot, they'll get irritated, angry. At home at the children, they'll be shouting and they'll be saying things to them which they don't want to actually hurt. So there'll be a sudden change in their behavior, which is unexpected and unnecessary sometimes. So when, as friends, now you all are there in the elderly age group over here. If you have got friends or anyone, for that matter, even you are going through something like this, I think it's important for you to identify these symptoms and signs which can help someone from going into depression, because loneliness is the start of depression. Loneliness is one of the cause which can cause depression in elderly. One of the major causes I would say is loneliness, right? So in elderly, then when someone comes in depression to us, loneliness is something which we have to see as doctors. Okay, now first as psychiatrists or as caregivers, now there'll be some caregivers also over here who look after some elderly people who are undergoing issues. So as I'm a psychiatrist, you're a caregivers, if there is anyone around you who is facing loneliness, maximum like whatever you can do minimum is for that person is that you just sit and chat for 5 to 10 minutes, let them just speak out what exactly is happening in their mind, or some they would just want to tell you what has amused them for the day or made them happy for the day, made them sad for the day for that matter. 5 10 minutes spending with that person also will help them come out of that feeling that there's no one to listen to. So that is very important that we have to see to that the elderly in our house or elderly in our society are given that respect even after they have retired or retired from their responsibilities otherwise, because they still are a very important part of our life, because they are the ones who have got immense experience and they are holding all that experience in themselves, and it's important for us to hold them back because that experience is very important for us, right? So strategies as psychiatrists and caregivers for. So, as psychiatrists, we do have these group therapies which happen. So, there are many of these group sessions which are held, wherein many old people they are a part of that group, and they discuss, they talk to each other about their day to day life, about their children, about their wife. If any event has happened in their life, yes, they talk to each other. And what happens with this is they end up getting a lot of emotional support, and they feel okay, fine, I belong to some group. So that is something which is very important for them. Okay, belonging to that group. So here also in Goa, there are these 2-3 places which have got this old age, not, I would not say old age home as such, there are old age homes also, but some trustee has started nice places where old people can meet and they have these games. Okay, they have dance, they have some celebrations of birthdays of each other. So it's a very nice way where they can come and they can meet and they can talk to each other in that old age, and that helps them kind of vent out. Because many of them, their children are studying outside or they're working outside in Goa. We have a culture where most of the children are abroad. So here, many of them are staying alone, and that really, this kind of a group therapy really helps them. That brings their energy back, kind of. We have to promote physical health because regular exercising, health checkups is very important for old age also as well as young age. Physical activity, whatever is possible as per their mobility, like as per how much they can move, they have to start doing physical activity because the physical activity will help. One thing is it releases endorphins, so that makes a person happy. It's a feel good hormone. Okay, feel good chemical, we can say neurotransmitter, we call it. Okay, so for you all, I'll say it's a feel good hormone which is released after exercise. And this physical activity can provide a lot of opportunities for social interaction also, for that matter. So the interaction can increase. Okay, you can meet different people when you go in for the physical health activities. Next is the cognitive behavior approaches that is used by us as psychological, as psychiatrists, counselors, techniques that caregivers or doctors can use. Individuals challenge negative thoughts. A lot of the times, negative thoughts come in. Like a couple is there, elderly couple is there. The wife will think, what will happen to me when the husband, passes off, or husband might think, what will happen to me when my wife, who's doing everything for me, passes off. So this kind of negative thoughts, when they keep coming, okay, in a way, by giving this cognitive behavior approaches, we can help the patients or the elderly couple who's facing this issue have, reduce the negative thoughts. So this can be done through engaging activities like stimulate their cognitive function and social skills. So it's very important that they are very busy. So things like Sudoku, like solving crosswords, it's very important that they keep their mind engaged. And what I would say is that yes, like one of the spouse will have to exit earlier, but it's important to spend whatever time is there with each other. It's very important to spend it in positive way without even thinking negatively. That is very important. Another way is empowering the elderly, that is self-help strategies. The way I said, whatever hobbies or interests maybe you had in the young age, which probably due to your responsibilities of family or something like that, whatever came up, you got married early in the age, then you started your family, you had to earn for the family, so all your hobbies and interests got lost at that time. There's no age bar for learning hobbies and interests. So you can even start at 60, 65 also. I have my own aunt who started her Kathak classes at the age of 60, and at 65 she has got a certificate of completion of her 5 years. So which is really commendable because this was her dream which she wanted to do early in her young age. She was married very early, okay, and she had children, so she could not pursue her passion. But after she retired at 60, she thought she had got all the time because the sons also had grown up and married. So she decided to join the classes and she's done it. Last year she underwent angioplasty also, but still she has continued after that, after taking doctor's advice. So I mean, whatever it is, if the passion is there and if physically you're able to do it, what I would say is whatever has remained that time, you can still do it. There are lots of ways available currently through YouTube and a lot of ways you can learn new things. So every day, if you decide to learn something new, I think all the resources are available currently. Okay, there are other things like gardening, knitting, painting, attending book clubs, and a lot of places now are having this elderly book clubs also, wherever the elderly can go, and there are lots of books which you can read and come and discuss about it. Kind of give a summary of the books. So that also helps in kind of keeping your mind active, and you can actually interact with people also. Another way of empowering is technology use. It's very nice to see a lot of elderly using new and new technology which is coming up. Like WhatsApp is a very good example. I think elderly are using WhatsApp very well. I have one patient who comes to me. She's 87 years old, and the first time she came to me, I thought she's going to pay me in cash. She got her phone out and she asked for my QR code and she Google paid me. That was really I was really surprised because it was very, like, it was nice to see that a person at 87 has learned how to Google Pay, which is a basic thing now for us as young people. But at 87, if you can learn something new, it's commendable. So I think technology use is very important because that again keeps your mind active, and dementia is something which you can push off then, right? The potential of technology is reducing loneliness, such as using tablets or smartphones for video calls with family. So it is also making you remain connected with your family, participate in virtual communities or playing games. So during COVID, a lot of virtual groups came up where the elderly could communicate or attend such functions or family functions or birthdays which they could not attend because of physical disability, right? So this is also a good way of keeping connected and throwing away loneliness completely from your life. Then volunteering, okay, engaging in community service can also provide a sense of purpose and opportunities for social interaction. So a lot of elderly people over here in Goa, what I have seen is like they get into this spiritual helping. Many of the Catholics, they do church work, and many Hindus or Muslims are doing their work. Hindus are doing their temple work. They go into temple committees and they start helping the temple work. So it's very important that you start volunteering, engaging in community service, because all your life, yes, you have done some service. Okay, you've done some service, you have got some returns back. Now maybe it is a time to do some service for social society, which probably you also feel good about doing social service. So it's important that you engage in that also. Now, how does technology help in reducing loneliness? Now, virtual communities, there is a lot of online support communities are coming up now. The way we are also talking now, it's a nice way of remaining remaining connected. Okay, it is important that we form such more online support groups wherein you can also seek a lot of help for elderly, for young people coming in now. This is helping us to kind of cut down the distance. Now, I'm in Goa, you are in Bangalore. We are able to talk this way, which is very important, right? So virtual communities are helping a lot in kind of cutting off the loneliness, because it makes you remain connected to someone outside your. Assistive technologies is introducing apps and devices designed for elderly health and social. There are lots of apps coming now. Are you able to hear me, everyone?
It's better, ma, but still there are issues there. I mean, occasionally this thing is going up.
Can you hear me?
Yeah, occasionally there is a problem. Yeah. Anyway, go ahead, ma, go ahead.
Okay, fine. Okay, assistive technology apps and devices which are designed for elderly. So if you go on the Play Store, there are a lot of apps which are there for elderly, which can track your sleep, which can track your daily movement, which can track your connect. Even I think there are some social apps also which help in connections. So I think that is very important that you download such apps which will keep you connected with people. Okay, and also barrier solution, acknowledge the barriers to technology use. Now if you're not able to, okay, then it's important that we as youngsters, we bring in that digital literacy. Okay, and we teach you how there's no fear, like there should be no fear of privacy invasion. So that is important for you to learn. Okay, that everything is not something to get scared of online. Okay, but there are safe ways of handling these things. Very important is that you have to learn that there are certain times scams also happening. Okay, when you're learning technology, it's important for you to understand that, okay, fine, for loneliness and for being connected, I have learned about technology and I have started using some certain apps. Fine, fair enough. But you have to be very careful about using these apps also, because many a times these apps lead to some some scams also. Like one of my patient came in, I think he suddenly got a video call. He picked the video call, but then that video call, there was some person. Okay, first one man was talking to him on the video call and trying to explain to him something, and suddenly one girl came in to talk. And after that girl came in, the video call went off. After which he started getting calls from that girl saying that you have taken my photos and videos and I'm going to sue you. So he ended up paying her money out of the fear of being, defamed or something like that. So these kind of scam calls, just be aware about the video calls and stuff, because there are people doing scams with elderly people like that. So I'm just talking a little out of the way because I thought I should just give you this one example. So it's important for you to learn the digital whole thing without having the fear in your mind, at the same time being safe with it. So there are different ways with which you can remain connected and not feel lonely. Okay, you can see in that one picture where maybe the grandparents are talking to their children, grandchildren, okay, interacting with them. There is something known as VR. Okay, that lady has been shown some like video where she feels like she can see it or feel it, right? You can use it for setting alarms. Okay, you can set it reminders. You can set as per as with your old age. Maybe certain things you'll end up forgetting. You can put reminders. Again, you can see another grandmother who probably is talking to a grandchild, giving flying kisses. So she's feeling connected. She's not remaining lonely, right? And there were more, there's a new robotic thing come up which helps, like, it's like you talk to that and then it generates like a chat and you feel like you're chatting with someone. So now with technology, I think loneliness should not remain like a problem if we are using technology very well, or we are using our thoughts in a way that, okay, they're positive and they're productive. Because what I would say is that, see, loneliness is something which is going to come at some age or the other. But how to handle it is very, very important. When we are working, we are so busy the whole day that we don't have time for ourselves. So that's where our hobbies and our interests get lost. So we have to see to that, okay, fine, today if I'm not able to do something, when I grow older and I have that all the time for myself, and if I'm healthy physically and mentally, I'm going to do this. And I think if any of you all or all of you all, if you feel today that there was something which had remained back then, the young age group, when you are looking after your children, you're doing everything, and you can do it today physically, please try and do it. It could be anything for that matter. Could be anything for that matter, even starting to, like, gardening or knitting, whatever for that matter, you can start doing that. So it's important that in the elderly age group, what I take home message, what I will give you is that uh, first thing is that identify the group. Okay, identify a group, make a group, be it virtual, be it in person. Okay, in person is always good. Okay, because you end up meeting each other, you end up getting out of the house for that, you end up taking some fresh air, you end up discussing more. Okay, there are no connectivity issues the way I am having currently. So I think that is a better way of meeting in person. Uh, Second thing is that uh, whole day of yours, see if you can schedule it and make like a timetable wherein you can put every important aspect of the day in a good time, which you can follow and you can complete it properly. Okay. Third thing is that see to it that you're using technology to the fullest in cutting your loneliness completely. Listen to music, because that's also a therapy in the old age. Okay, on technology, on mobile phones, you'll have lots of apps with which you can play games which can, improvise your mind quality or mind thoughts or what everything. So that is something which is important. So using the apps in a correct way, that is also very, very important. If you feel this loneliness is turning into some sort of depression wherein your productivity is going down, your functioning is going down, then you need to meet a doctor. You need to meet a psychologist or a doctor. That is very important to identify that, not only in yourself, but maybe any of your friends also, if they are suffering. It's important that you identify them and meet someone. So these are the few things which I wanted to speak on loneliness to you all. I would be very happy if you all have any questions.
Yes, yeah, thank you, doctor. Thank you.
Thank you, sir.
Yeah. See, in fact, there are people have raised a couple of questions in the chat box also. But in the meanwhile, I mean, I have got one question, doctor. That is, see, what I'm asking is that you say that you meet the doctor. What is the stage at which I should go and meet the doctor?
I didn't get you, sorry.
What is the stage at which the person needs medical intervention? Can you just identify that stage?
I'll So what happens is that loneliness is something which looks like depression, but the moment you meet people, you go to meet people and you are in a group and community, you start feeling good. Okay, depression is something that you have met people also, you enjoy with them also. But at the same time, when you're meeting them, you're doing something you like also, but you're not feeling happy. It'll cut down on your productivity. You will not feel like getting up from your bed. You will not feel like smiling at anyone. You will not feel like doing anything. That is depression, when your productivity completely goes down. Okay. Now, depression is something where the productivity has gone up, functioning has gone down. You meet a doctor. Only loneliness, if you are able to tackle with whatever I have told you, it is not to be shown to a doctor. But if you think it is not helping, even doing all these things is not helping, you will have to meet a doctor.
Yeah, therefore, I mean, we have to be careful about, I mean,
Yes.
before suggesting to meet the doctor, we have to ensure that this person is definitely feeling out of the way
Yes.
and he needs some medical help. That
Yes.
kind of a, okay. So now, Mr. Ramnath has raised his hand. Ramnath, can you just answer? Can you just, Ramnath? Ramnath?
Hello.
Okay. Yeah.
Good evening, doctor.
Good evening.
In general, elderly ladies are better than the gents because
I
they
didn't.
engage in household work, etc. But the gents are very much felt this thing very loneliness, and they usually go to the temple frequently and sit lonely and think about past things and present things, and how to lead by our life till the end, like that, whether the sons are helping or not. So, what is the solution?
So the solution, that's why I said, Mr. Ramnath, ki as a female, what happens is you, if you're not, you have been a housewife, no, as a female, then housewives never retire. So they don't have a retirement age as such. So they'll continue. They will never feel the need to get out and feel lonely. But as a man, you have worked till 60 in a group, in a company. Suddenly at 60 when you retire, that's when you start feeling lonely.
No, hello, madam. Only I am talking about a widow gents. In the foreign country, they are paid people to talk to elders, but not like that in India. Even the old age home go there.
Here we don't have anything like that. Yeah.
Tell me.
Here we don't have anything like that. But yes.
No.
But what you can do is that
family problems.
yes. No, in India we don't have any, I mean, we might get in the future, but then currently what I would suggest to you is forming a group of your own where you can make friends. Now here, see, you have so many friends over on this group.
That is the
Ramnath, kindly listen to the doctor now. Ramnath, please listen to the doctor. You can raise the question later. Please go ahead, please.
So what I was saying is that it's important for you to understand that now that you've been widowed and you're alone at home, it's important that you make a group. You've already made a group. Now all these people over here who are there, they know you. I think you can keep such more meetings where you can meet each other more. And whatever is being discussed over, start implementing that on your life, in your life. I mean, whatever, like, have spiritual groups, going to temples, attending temple groups, having different, maybe in the evenings you can go and just sit in your society wherein all the elderly people sit. That you can do, taking walks in the evening, okay, listening to music. So all these things can help you spend your time and day.
Ramnath, if you want to respond, please do it now. Ramnath?
hello.
Yeah. Tell me.
Oh, no, nothing. Thank you.
Yes, you are satisfied. Yes. So
Yes.
only thing is, yes, forming our own groups and again being in touch with people. And in fact, we have several groups like that in Bangalore, doctor. See,
Yes.
the old, especially the.
I'm sure Bangalore will have a lot of groups because in Goa also, itself we are having so many groups now. I'm sure Bangalore will have a lot of groups.
And regarding this, the apps, etc. See, Dr. Mahesh, who has joined us, as Mahesh Yamadri, who is also one of the participants. He is also practicing in Lonova. So he is a geriatric specialist. He has conducted one session on exclusively on this, the usage of apps and what are all the apps that are available for the old man. So in fact, that video is available in our VMS collection. Yeah, in our YouTube channel, it is available.
YouTube channels. See, YouTube channels meaning there'll be, if you even put geriatric like old age health channels, right? On YouTube, then you will get links. One thing is that, and on what apps I'm speaking about, there was this app a long time back during COVID time when you could chat people. I mean, there was a chat group made of 30 people. I just check if it's still there. If it isn't, send it to Vayomanasa sir and then he'll send it to you all. Plus, there will be some apps of games where there'll be crosswords, there'll be Sudoku. So that will help in kind of keeping the memory active also. Whatever app links I will send to Jamunathan sir and he will send it to you all. I will just do that.
Yeah, that will be very helpful. I will share it with our group.
No, I will do it, sir. I will do it. I will send it to
All
you.
are aware of this. But we are, I mean, we have some 30, 40 apps we have identified. Dr. Mahesh has
Very
identified.
good.
Yeah, that we
Whichever
have.
I know of, a few of them which I maybe you all will be knowing more than me, maybe I don't know.
No,
But
not
whichever
that
I
way,
know,
doctor.
I will just send. I will just send. If they're not common, please use them.
Right. These are all evolving fields.
Huh.
Therefore, therefore what happens, at the, I mean, every day some new thing is coming.
Huh.
And the rate of obsolescence is
It
very
will keep coming.
Yeah.
It will keep coming that way. That's what.
Keep coming. Therefore, as you rightly pointed out, I think we have also had sessions on how to prevent this elder people being fooled by this, social media.
I told you, I gave an example also. Very bad that was. The patient came in depression. He was 68-year-old. It was really bad, poor thing. So you will have to be a little careful also with the apps because a lot of scams are happening these days.
Yes, doctor, and they are, trying to, target these seniors.
Yes, absolutely. Absolutely.
And that we need to be careful. But anyway, I think lots
Absolutely.
of,
Absolutely.
in today's context, lots of, good apps are available to prevent to get into these kinds of situations. No, even
Yes.
thing like Truecaller, it's a helping us. There is a, one.
Very, yeah. Yes. It helps a lot. Truecaller helps me also in understanding which patients, what are spam numbers also. So it's very important.
Yeah, so that was
So what I'm saying is that
tell me, doctor, tell me.
no, go on. No, go on. No problem.
See, in fact, we need to use those technology-wise. I think we need to learn it fully. There is no point in learning it off. Therefore, I think we have lots
Yes,
of
of course.
the safeguards available. We need to use that, but
Of course.
without using technology, I think it will be very difficult to live.
No. Now you have to use it because it is a part and parcel of our life. And I
Exactly.
think as elderly, if you all can learn that, that's going to keep your mind also very, very active.
Yes,
So
doctor.
I think it's important that you learn it.
Yes, doctor. Yes, doctor. That's nice. So, any other person I would like to any other questions, sir?
Sir, Truecaller, Truecaller, I was told that they can steal the data and other things. Truecaller, few says that it is not good to use that app. I don't know exact reason and other things, but for having heard or for having told these things, I have deleted Truecaller.
Deleted Truecaller. What is the reason, sir?
Reason is they have got accessibility to cyber crimes for scope for cyber crimes. I was told.
I don't know. Can you just come again, sir? Because your voice is breaking.
Acha. Okay. Anyway, the Truecaller issue we'll discuss some other time also.
Okay, sir. Okay, that is fine. That is excellent. In fact, in these meetings, sir, we are very clear about one thing. That we don't endorse any brand. We don't promote any products.
Correct.
We are clear on that. See, in fact, our idea is that it is only a suggestion. Even when one doctor says that you do this, better to consult your own physician, your own doctors.
Exactly.
Yeah, that is doctor is giving some general guidelines. When you can go, when you have to go and see the doctor. That kind of the guidelines only she is giving.
Okay.
Yeah, we are very clear about that because we do not want to promote anything here.
Yes.
Being a government channel, and our intention is that to sell pure knowledge, to distribute pure knowledge. That's all. See, in the context of this WhatsApp university, where I think everything gets promoted. So in that context, we thought that this channel was started only to, distribute knowledge to people, so that people understand that what is good. And here I tell you one thing is that all the speakers are highly educated people. See, we should be thankful to them for the agreeing to spend the time with us and educate us. Because
Yes.
these kinds of doctors, we will not be able to even spend 5 minutes when we meet them and have consultation.
Yes.
See,
Yes.
there they are sick. Here they are coming to us and taking so they are taking lots of pain in educating us. See, that way we are very grateful to you, doctors. See, but this is, I mean, we don't promote,
most welcome.
we don't promote anything like that. Please do not think that I am trying to say, just out of so many,
No.
I was just mentioning this app, that's all. You, I mean,
That's correct. That's correct. Absolutely correct.
so, I mean, get your knowledge. And one more thing is that most of your grandson, see, your son or daughter may be very busy, but your grandson, granddaughter might be able to help you, because they are also very good in technology now. They are,
Correct.
they are born
Yes,
with
yes.
technology.
Yeah.
Every
Very
age.
true. Very true.
See, that is the only thing. Therefore, we need to use them and discuss them, and this also gives an opportunity to interact with us and bond with them. That is also one opportunity. Yes, doctor.
Correct.
Thank you.
Correct.
Yes. Yes.
Thank you. Any other person? Any other doubts, sir? Madam? And there is one suggestion also, madam, doctor. See,
Yeah.
we need to make this loneliness as a issue to the government of India. See, they have not flagged this as a senior sensitive issue. So we need to do that from your end whenever you are attending some government functions or something like that. You may have to tell that government that this is a serious issue, and especially when in the context of the growing elderly population. See, the elderly population is growing day by day, and it is anticipated that in another 10 years' time, nearly 20% of the population is going to be elderly. Senior.
Correct.
Yeah,
That's true.
in that context, I think
Not only health issues, even the financial issues like minimum EPF pension, the 1,500, 2,000. How can they manage that meager amount? So even many trade unions and other things are raised the issue, and our film actor Hema Malini has seriously raised this issue in Lok Sabha also. She was after that also, but somehow government could not take up this issue. Still, maybe next budget or in between they may take. I don't know, but some promises have been made to enhance minimum pension of 7,500 per month. Against 2,000 rupees and add as of 2,000 is nothing, because for having spent 30 years of service or 25 years of service and giving so much of EPF fund, crores of funds, unclaimed crores of rupees are there left with the pension for EPF office, and no claims. Many have died and nobody is claiming. So at least with that amount, they can decide a fairly good, respectable amount of pension, apart from your health apps and other things. Even government can consider an health app, like what is being considered by Google for physically handicapped. I was told that it is going to be launched very soon. Physically handicapped, separate one app is coming up. So with that app, they can hold a badge-like thing, and their movements will be known to them. That's what I heard. In physically handicapped, one of the NGO, they visited our senior citizen office and told that we are going to launch a Google app to physically handicapped. So after that, for other senior citizens also, it can be made use by required modification and other thing, as Jamuna sir rightly told. Government, central government and state government should give some respect. We also wrote many government letters to Ramangar Reddy sir in state, saying that we enhance the concession from 20 to 50%, like in other state. In one of the state, 50,000 rupees, 50% bus concession is there. Same we quoted and sent. Now Ramangar Reddy sir promptly replied, as of now, we may not be able to consider the request because of constraints and other things. That's how it is going on. Anyway, everybody should contribute without neglecting the seniors in anymore. It is high time to start give a due respect to the government. by the government to the people, particularly senior citizens.
Yeah, it is happening, sir. Slowly it is happening, sir. It is happening. People are understanding that seniors also need to be respected and they need to be taken care of.
Yes.
There are
Thank
certain.
you, Jimnath sir. Rightly, you even I also I did not add any in the description. Hello.
Thank you,
Yeah,
sir.
anyway, thank you
Please,
so
sir,
much.
please. Hello. Hello. Any other person wants to speak? Any other person?
Hello.
Yes, doctor. I'm there.
Yeah, my range again went off. Sorry. Yeah.
Yeah, I'm there. I'm there. We are all there. See that.
Hey, not enough.
So, I mean, if there is no other question, I think doctors, we should value doctors' time. So she has to, I mean, attend to her practice also because patients will be waiting for her. So I think, doctor, I mean, this is time that we close down. Please, thank you. I mean,
Thank you so much. I'll be happy to help again. Let me know, please.
sure, doctor. But my only request is that if you can share this presentation in my.
I will share. I will share you
my
later.
WhatsApp. My WhatsApp.
Just send me your email address, no, sir. I will send
Oh,
you.
yeah, I will send my email address. That I do, doctor. And in fact, we as a senior citizens, you have spent a lot of your time and effort and you have taken so much.
Most welcome. Most welcome.
So, these are all the days when we are also thinking of return gift. The return gift that we can think is that, okay, we pray for the welfare of yourself and your family.
Thank you so much. That is most important.
So,
thank you so much.
Thank you. Thank you, doctor. God bless you. Bye.
Thank you.